Hello and welcome to today's Screencast. My name is Autumn Van Hoos, and today I will be talking all about Pakistan's healthcare, mainly focusing on their future goals. Goals are great, aren't they? They really help you focus on what's next while motivating you in the now. Pakistan, like any location, has lots to improve. I must admit, improving healthcare anywhere is a good idea, but Pakistan is a bit behind compared to other countries. The focus topic, as I mentioned, is healthcare in Pakistan. Healthcare in Pakistan is administered mainly in the private sector, which accounts for approximately 80% of all outpatient visits. Pakistan's healthcare delivery system includes both state and non-state, and profit and non-profit service provision. That is taken from Wikipedia. This here on the right is a picture of a doctor's office in Pakistan. As you can see, compared to America, it's a lot less professional looking, but they are still able to take care of this young boy to the best of their ability. This is a quote. Minister said that the future of Pakistan lies in the future of its people. For a bright future, the people need to be able to perform at the best which they can only be possible if they are living healthy and productive lives. I really enjoy this picture because although they look unhappy, I can still see that they are all together in unity. And I love that. And as for this, I love how it says that Pakistan lies in the future of its people, because they're not focusing on the past, they're focusing on the present and them being together and united as one. That was a lot of the information we just took in. Let's talk about it and break it down. The last 5 years will help us predict the future more clearly. In the last 5 years, Pakistan's government has made efforts to enhance the health services available to people. Personally, I think it's a wonderful realization for a country to desire a better healthcare system. There are so many people that go without proper healthcare in this world. So any and every little bit truly does make a difference and truly does count. Pakistan and the minister is making an effort, and they have predictions of what the healthcare will look like in the next 5 years. Interesting, isn't it? I just love how they are trying to branch out and provide better healthcare for their families and for even the government and the ministers. How will enhanced healthcare affect Pakistan as a whole? Malnutrition is one of the most significant public health problems in Pakistan, and especially among children. That's once again from Wikipedia, the quote we took earlier in slide 1. After reading that, I came to believe that enhanced healthcare will be able to focus a lot of attention on those malnourished children and help them get the things they need. I think that malnutrition is something that we don't see in the United States, but it is something that is very popular, especially in Pakistan, and my heart broke a little bit reading about the malnutrition rates in Pakistan. I actually thought, well, why don't more people make money? Sure enough, they want to increase the employment opportunities. An increase in the healthcare workforce will give out more employment opportunities. That, in my opinion, ties in with children being malnourished because the people are working, the more they can afford things such as proper meals. So more mothers will be able to get jobs and be able to pay for their children to have more meals as opposed to just one small meal a day. So the nurses and the midwives is a perfect transition, as you can see. On the right here is a picture of nurses and midwives in training. This is what their school looks like. The current production capacity of nurses and midwives is around 9,000, which needs to be doubled over the next 5 years, for which new nursing schools and colleges needs to be put in place. In addition to a new focus on the production of nurses, Pakistan wishes to modernize the nursing education. I really would like to finish off and elaborate on that modernization because nurses in Pakistan, they are less advanced than the nurses in other countries such as the United States. So what Pakistan is really trying to do is educate the nurses and the midwives on the more modern technology and the more modern ways to help someone get better and help someone with surgeries or with birth, childcare, etc. These are my references. I really hope you enjoyed my screencast on healthcare in Pakistan.